Hello and welcome. Today we're diving into a condition affecting the urinary system, ureteral stricture. This condition, which involves a narrowing of the ureter, can lead to a host of complications. Join us as we explore its causes, how it affects the body, how it's diagnosed, and the various treatment options available. So, what causes a ureteral stricture? The etiology, or causes, can be broadly categorized. Congenital strictures, present from birth, are due to developmental abnormalities of the ureter. Acquired strictures are more common and often result from injury or inflammation. These can be caused by kidney stones, surgeries near the ureter such as hysterectomies or colon resections, radiation therapy, infections like tuberculosis, or even tumors that compress or invade the ureter. Occasionally, the cause remains unknown, termed idiopathic ureteral stricture. Now, let's understand the pathophysiology, or how a ureteral stricture affects the body. A narrowed ureter obstructs the flow of urine from the kidney to the bladder. This obstruction leads to hydronephrosis, which is a swelling of the kidney due to urine backup. The increased pressure within the kidney can damage its delicate structures, potentially leading to impaired kidney function. Prolonged obstruction can also increase the risk of kidney infections, known as pyelonephritis, further compromising kidney health. Regarding epidemiology, it's difficult to pinpoint the exact prevalence of ureteral strictures. This is because many cases may be asymptomatic and go undiagnosed. However, we know that acquired strictures are more common than congenital ones. Factors such as a history of kidney stones, previous urinary tract surgeries, or radiation exposure increase the risk of developing a stricture. Certain populations, like those with a history of recurrent UTIs or specific genetic predispositions, may also have a higher risk. Recognizing the signs and symptoms is crucial for early diagnosis and treatment. Many individuals with mild strictures may be asymptomatic initially. However, as the obstruction worsens, symptoms may develop. These can include flank pain, which is pain in the side or back, recurrent urinary tract infections, painful urination, blood in the urine, known as hematuria, frequent urination, and in severe cases, kidney failure. In children, symptoms might be less specific, such as irritability, poor feeding, or failure to thrive. Diagnosing ureteral stricture involves a thorough evaluation. The process typically begins with a physical examination and a review of the patient's medical history. Urine tests are performed to check for infection in blood. Imaging studies play a key role in confirming the diagnosis. An intravenous pyelogram, or IVP, involves injecting a contrast dye into a vein and taking X-rays to visualize the urinary tract. A retrograde pyelogram involves injecting dye directly into the ureter through a cystoscope. CT scans and MRI scans can provide more detailed images of the ureter and surrounding structures. A renal scan can assess kidney function. Ureteroscopy, using a small camera inserted into the ureter, allows direct visualization of the stricture. While ureteral strictures aren't typically classified into distinct types in the same way as some other conditions, they can be described based on their location, length, and cause. For example, a stricture can be described as proximal, mid, or distal, referring to its location along the ureter. They can also be described as short or long segment strictures. Understanding these characteristics helps guide treatment decisions. Treatment and management of ureteral stricture aim to relieve the obstruction and restore normal urine flow. The approach depends on the severity, location, and length of the stricture, as well as the patient's overall health. Conservative management, such as observation and pain management, may be appropriate for mild, asymptomatic strictures. For more significant strictures, interventions are necessary. These include endoscopic procedures like balloon dilation, where a balloon is inflated to widen the stricture, or ureteroscopic incision, where the stricture is cut open using a laser or blade. In some cases, a ureteral stent, a small tube placed inside the ureter, may be inserted to keep it open. For long or complex strictures, open or laparoscopic surgical reconstruction, such as ureterostomy, reconnecting the cut ends of the ureter, ureteroneocystostomy, reimplanting the ureter into the bladder, or even using a segment of bowel to replace the damaged ureter, may be necessary. Preventing ureteral strictures, particularly acquired ones, involves addressing the underlying causes. Prompt treatment of kidney stones can prevent them from causing ureteral damage. Minimizing trauma during urinary tract surgeries can also reduce the risk. Avoiding unnecessary radiation exposure to the pelvic area is important. Staying adequately hydrated and promptly treating urinary tract infections can help maintain a healthy urinary system. The prognosis for ureteral strictures is generally good with appropriate treatment. Early diagnosis and intervention are crucial to prevent permanent kidney damage. The success rates of various treatment options vary depending on the complexity of the stricture and the patient's overall health. Recent research focuses on developing less invasive techniques for ureteral reconstruction and improving the long-term outcomes of ureteral stent placement. Ongoing studies are also exploring the potential role of regenerative medicine in repairing damaged ureteral tissue. Thank you for joining us on this exploration of ureteral stricture. We hope you found this information helpful.